there has to be a genuine desire to help others. I mean, that is what we live by, and that is what we do.
Welcome to TSU Human Performance Sports Science Podcast, where we dive into the fascinating world of sports science and innovation, right here at Tennessee State University.
We are your hosts,
I'm Nil
and Franka Nil, and today we are taking you on an exciting journey to educate, entertain, and keep you up to date of happenings right here on our campus.
In each episode of TSU HPSS, we'll bring you exclusive interviews with our expert faculty, coaches, student athletes, and our students from our departments who are making stride in this field.
You will gain the insights into the latest training techniques, nutrition strategies, and sports psychology breakthroughs that are now shaping the future of sports performance.
All while bringing it to you from an HBCU perspective. Hello everyone and welcome back to our new episode of HPSS Podcast. Today we have Ronald Barredo. He is the Dean of the College of Health Science. Welcome to our podcast.
Thank you so much for having me.
So he's going to start by introducing himself and tell us a little bit about how you became the Dean.
Sure, thank you for the question. So I'm a physical therapist by education and profession. I've been working in the clinics for about 10 years, and one of my colleagues asked if I wanted to serve as an adjunct faculty in the Department of Physical Therapy, and so I did, and I taught for a couple of years as an adjunct. The chair back then invited me or asked me if I wanted to serve full-time in academia. And so after thinking about it, I said, let me go ahead. And so I transitioned from being a full-time clinician to the academic setting. And so I served as faculty. I served as chair of the program for 10 years. I also served as assistant dean for about 5 years, and then now in my current position as dean.
How's that been so far? Do you have you found it a little bit more challenging to transfer from a physical therapist to a dean?
I think the interesting thing about being a clinician is you work with patients on a one-on-one basis. In academia, especially in the role of dean, you manage a whole lot of programs and a whole lot of faculty. So there is that difference, but the people aspect is the same. When you work with patients and you work with individual faculty and program directors, I think it's similar in that way.
So you said when you were asked to serve in academia, you needed to think about it. So what was the thought that drew you into this field?
So I think it's very interesting that in the field of physical therapy, you want to make sure, and I think it's in healthcare in general, you want to make sure that you are assured that clinicians are very competent in what they need to do. And so my investment in going into the academic setting is to make sure that I have a hand in molding future physical therapists back then, because I was in the physical therapy department, and ensuring that the future clinicians are up to par and able to pass their licensing exams and practice as physical therapists.
Can you tell us maybe something about the program within the college? Like what are the focuses on?
Sure. So in my role as dean, I serve one of the largest, if not the largest academic college at Tennessee State University. We have 8 departments and 17 programs. And those programs range from the associate 2-year degree level all the way to the baccalaureate, master's, and doctoral levels. When you look at the College of Health Sciences, you can classify them as either the business side of healthcare or the care side of healthcare. So when you think of the business side, you think of healthcare administration and planning, you think of health information management. When you think of the care side of healthcare, you talk about PT, OT, nursing, respiratory, those types of things. So we have a lot of programs, as I said, and so it's interesting to negotiate and to manage these programs.
So besides being the biggest program in school, what are the other things that make us? What are the other things that set us apart from the other fields
Sure.
on campus?
I think I'd have to go back to the mission of the college. And so, in short, we prepare tomorrow's healthcare leaders, and we do that by making sure that our programs are of quality and that we ensure student success. And so here in the college, that's always our purpose, is to make sure that our programs are strong and that the students are able to progress through the program. What's interesting is when you think of the health sciences, you think of the helping and healing arts. And so it's always a service mission that we have, making sure that we service our clients, our communities, and I think that's very helpful. What makes the college separate and apart is, obviously besides the service mission, is that we do have 3 functioning clinics, right? We have the dental hygiene clinic, which is found in Clement Hall. We have the Tiger Rehab Clinic that offers physical therapy and occupational therapy. That's in the Health Sciences building. And then we have the Speech Pathology Clinic that's at the Avon Williams campus. And so those types of clinics help provide care to uninsured or underinsured individuals in our community. So that helps in terms of the service mission. What also sets our program apart, our college apart, is that all accreditable programs are accredited. So our nursing program has its own accreditation, OT, PT, respiratory, public health, health information management. If there is a requirement for accreditation in any of those programs, that we are accredited. So that's what sets us apart also.
How does the college stay update within the last advancement, and how do you keep up with the new technologies?
Sure. You know, what's interesting about knowledge in general is it grows exponentially, right? And so it's important to be current with both the practice and the technology. As dean, I always say that the college is only as strong as its constituent programs. And the programs are only as strong as the faculty and staff who are there. So a lot of advancements in both technology and practice need to be addressed at a faculty level first to make sure that they are very current in what they need to do. I think also part of it is that to ensure that we are very current in what we do, we have advisory boards. So a number of our programs have advisory boards that are constituted of clinicians, employers, previous graduates that keep us updated on, hey, this is the newest technology, or here's the newest practice. And so we consider that when we do our planning for each of our programs.
What are some of the biggest challenges you ever face as a dean now? And what are the challenge within the college itself?
Sure. What's interesting with the College of Health Sciences and health sciences in general, and I often say this when I go to local high schools or local feeder colleges, is the fact that as long as there is sickness in the world, or as long as there are people who want to live happy, healthy lives, there will always be a need for healthcare. So we have recession-proof programs. And I think part of the challenge there is that being a large college, we need to make sure that we have enough courses and enough faculty to offer to our students. And so I work closely with the chairs and the program directors to figure out, what are the needs that your program has. And we work with the Office of Academic Affairs to make sure that we have the appropriate number of faculty, appropriate number of or amount of resources to help the programs. But I think with a large college, you need to make sure that the program's needs are met so that they can in turn offer appropriate and academic quality programs to their students.
So speaking of the problems, lately, we're going a little bit to the past to the COVID year. How did you handle that pandemic?
That's a good question, and that's several years back. Let me first congratulate nursing, respiratory care, and public health, because they were the three pivotal programs that were directly affected by the pandemic. Obviously, the nursing shortage and nurses on the front line. Cardiorespiratory, COVID is a respiratory condition. So we've had some entities call our college to find out if there is a need for respiratory or ventilators to be used, can we use yours? And so we had to coordinate that with them. Public health was essential because of the COVID being the pandemic, right? And so we needed to make sure that we have accurate information that we shared with the public about what COVID is and what we can do to prevent it. Now, the challenge with the pandemic is the fact that in the College of Health Sciences, especially with the clinical programs, we are a high-touch college, meaning that a physical therapist can't just learn something from a textbook, or an OT, or a nurse, or a respiratory therapist, or someone from HPSS. There needs to be the high touch. And so one of the quick things we did, much like every other program in the U.S., right, is for the didactic component to shift quickly to the virtual format. Now that was a challenge in and of itself. But I think the more challenging one was, how do we ensure that the skills that the students have to practice are able to be done? And so we had to have a lot of conversation with academic affairs, with facilities, to ensure that we are able to practice safely and use the appropriate precautions. And so during that time, we had lower ratio of student pairs practicing on each other. And we needed to make sure that those pairs, because usually in a non-pandemic year, you pair up with every other individual. But during that time, your partner will be your partner throughout the entire matriculation, just so that if in case one gets COVID, then the only risk is the other partner. And so we had to pivot around that way. And of course, prior to the pandemic, we had labs where we had 16 students per lab, and they were partnered with each other. But during the pandemic, we had to scale that down to only 8 students per lab, and they were separated apart from each other, each of the pairs, farther away, use the masks and so forth and so on. So that's what we had to do. And I think we were able to do that successfully, and I'm glad about that.
So all of these solutions seems like they worked well. So that's good to hear. And my question is also, what are some other things how do you support the students also outside of the college?
Sure. So when it comes to student support, we want to make sure that the students are supported by faculty. As you know, faculty are the faculty experts. When they're in the health sciences, they have people with certain expertise in certain content areas. And so in some of our programs, those students who are accepted into the programs, they have assigned faculty members to serve as advisors. And so that's a way to do it. We also have in areas, for example, of research, we have faculty research advisors, and we assign them we have faculty being assigned to groups of 3 or 4, so that throughout their research process, they're able to go through it without any problems. So there's support in that area. We also do a lot of, in terms of student support, a lot of those high-impact practices involve faculty-student research, which is what we do a lot, especially in our graduate programs. High-impact practices also include internships, clinical placements. And so that helps support the students outside of the classroom. And of course, we have community activities, community engagement activities, so that the students can see the relevance of what they learn and how it can be applied to society and community.
So what would be some of the unique experiences that students can expect from College of Health Sciences?
So in terms of unique experiences, I've already touched on a couple. So one of them is clinical internships. As you know, in the clinical courses, a lot of our students learn the didactic information, and then they progress that by doing lab experiences in the classroom where they pair up with each other, practice the skills, but it cannot end there. They have to really practice with real patients. And so usually during the final year of their matriculation, they have clinical internships where they are assigned to a particular hospital, nursing home, or facility where they work with patients. And obviously there are clinical instructors who are there to teach them. And so that's an important aspect of it. A lot of our students have service learning experiences, and that's when you combine both didactic coursework with service. And so that's one of those things where, let me give you an example. I can say this only because I'm in physical therapy, and in physical therapy, whenever there's the week of the young child or during physical therapy month in October, we do a lot of service activities tied to our courses. So the week of the young child, we have in our pediatrics course, the instructor working with the students and working with kids. So this is like a university event, and so they're there. In fall, because it's the fall and October is physical therapy month, so we do fall screenings, right, in local nursing homes to make sure that that we are able to identify those who are at risk for falls. And so the service learning component is very strong.
Okay.
And then the last one that I've already touched on a while ago is the research component, especially with the graduate programs. They're required. They don't do dissertations or thesis. What they usually do are research projects that may be a year long or a year and a half long, where they answer certain types of research questions. And then they participate in, for example, the research symposium. And we've had students present at the state level, national level, even international level, their particular research. So those types of things, I think, are very strong.
Well, that's great that you bring up the research, because my next question would be, is there any notable research project or innovations coming out of the college, or what are current researches that we are doing?
Sure. I think in general, a lot of the research that goes on in the College of Health Sciences have to do with the helping and healing arts, or in terms of health services administration. In terms of the key things that are going on currently, we've received a grant, particularly the Public Health Department, where they established the Center for Maternal and Child Health. As you know, maternal and child issues is on the forefront in terms of their health. And so we were able to, through the Department of Public Health, Health Administration, Health Sciences, get a grant for the establishment of the Child and Maternal Health Center. We also have Project REACH, and that's the funding that is internal from Title III. REACH stands for Reinforcing Educational Advancement for Careers in Health, where we want students, particularly those who are underrepresented, to have a strong competitive background and profile so that when they get to apply to the majors, that they're very competitive. So we've had funding for that. And again, only because I come from physical therapy, a requirement for our students, and I think other students as well, OT and speech, they conduct their research and they present them as posters. But what's interesting is that in PT, about a third of the students before they graduate, they get published in peer-reviewed publications. And then again, that's of course topics related to physical therapy. So those are just some of the highlights.
Well, that sounds great. And also you mentioned that you're collaborating with the community in the months of physical therapy, and you're working with the pediatrics and the kids. So is there any significant partnerships or collaborations that the College of Health has?
Sure. We have partnerships first and foremost in terms of clinical sites, right? We have a whole lot of clinical sites where students are assigned to do their clinical work. So that's one of them. And so our partners go with nursing homes, hospitals, outpatient physical therapy, inpatient physical therapy, or inpatient rehab for OTs and We also have the school system for speech pathology. We have also educational partnerships. For example, in the past year or so, we had an MOU, a Memorandum of Understanding with the University of the Philippines, where we work with them on issues related to research, teaching, and service, and the primary programs for that particular MOU deal with physical therapy, occupational therapy, and speech. We have an existing MOU with MATC, the Milwaukee Area Technical College, where the purpose is because it's a community college, their students to get their baccalaureate degrees here at TSU. And so we've already established an MOU with the dental hygiene program, and then we have 2 more that are pending for the cardiorespiratory care program and the health information management program. We have other partnerships. The latest one, I think, is what occurred a week or so ago when we worked with the CDC. We hosted the CDC in terms of their infection and respiratory unit, talking about partnership possibilities in terms of internships, guest lectures, and that would affect nursing, respiratory care, public health. So those are just some of the partnerships that we have.
You said that you're the biggest college of TSU.
One of the biggest.
One of the biggest. So, what are your vision for the future of your college?
So, when it comes to the vision for the College of Health Sciences, I want to make sure that as dean, we continue to make ourselves relevant, because there are certain programs that was relevant 20 years ago, but may not be relevant now. We want to make sure that we continue to improve our programs. As I said, all of our programs are accredited. We want to ensure that they continue to be accredited, because that's the only way that we can show the entire community that our programs have been deemed by a third party to be quality programs, and that our pass rates are high, and that our faculty are qualified. But we also keep our ears to the ground, because what's interesting is, and that's why we have advisory boards, is we want to make sure what is the latest, what is going on. Is there a particular area that we need to look into? And so that's what we've done. And that part of my role as dean is to make sure not only that we are relevant, but that we are also on the forefront of the changes that are happening. One of the programs that we're starting hopefully soon is the PhD in public health. There is a lot of clamor for health scientists. And of course we have the MPH, but there has been a call for, PhD programs, especially in HBCUs, to work with community health and public health issues. So that's the type of thing that I'm saying is we need to make sure that we're on the forefront and knowing what the challenges and trends are.
Would that be one of the biggest plan that you have for the future for the college?
So we have certain things coming down the pipe, right? One of them is the PhD in public health, and then we also have our associate degrees in dental hygiene. Starting this fall, we will have the BS completion program, meaning those with associate degrees, and that's why I told you about the MOU with Milwaukee, right? Because a lot of their graduate with an associate degree. And so what's coming down the pike, besides a PhD in public health, is the Bachelor of Science completion program in dental hygiene. So some of our previous graduates, some of the graduates from other community colleges that have associate's degree can come in and then work on their baccalaureate degree. The physical therapy, OT, and speech pathology programs, they're looking at a PhD. It's still in the planning phases, so it'll still take a while. But it's one of those things that we keep looking at and asking our advisory board members, what is the need for this? Is there a need for this? And so they've identified that to be a need. And with the institution moving from R2 to R1, there's a greater need for doctorally prepared, graduates. And so that's why part of that, of what we're looking at in terms of environmental scanning, is knowing and then being able to go that direction.
What would be a good advice for any students that would like to pursue a career in health science?
I think in terms of motivation, there has to be a genuine desire to help others. I mean, that is what we live by, and that is what we do. But I think outside of that, knowing that health sciences programs are very competitive, that you as an individual also need to be competitive. Sometimes, or oftentimes in our programs, we have more applicants than there are slots. So if you are coming into or applying to a program and you meet the bare minimum, you can expect that there are others who have exceeded the minimum. And so your chances of getting into the program are lesser. And so that's why, besides having a genuine desire to help others, you have to be strong and competitive. Remember, in the health sciences, you work with people. You work with people's lives. You work with people's health trajectories. So we cannot afford to have students who are not prepared, because in the end, after they graduate, guess what? You need to have your licensing exam, right? And if you're not strong enough, you can't pass your licensing exam, then all you have for your diploma is a sheet of paper.
Yeah.
In order for you to practice, you have to have a license. And so that's why you need to be competitive.
Is there anything else that you would like to share with us about the College of Health Sciences?
I'd like to just thank you for the opportunity for inviting me here. This has been a very pleasant
It was
session
pleasure for us as well.
The college, as I said earlier, the college is only as strong as its programs. And the programs are only as strong as the people there, and the faculty, the staff, and the students. So we need to keep that in mind. And we also need to keep in mind the fact that once students leave our programs, then they work with patients or they work with healthcare businesses. And so we always have to keep that in mind also.
I do agree. And Nil and I here are going to try to represent our college as best as we can.
Fantastic. Thank you so much.
Thank you very much for coming one more time, and have a great day.
Thank you.